Hello, everybody. Welcome to Ad America. My name is Aninda, one of the EGATs here in Ad America, and we welcome you all joining us on this event today. Ad America is the U.S. Embassy's American Center, and our mission is to provide a space for young Indonesians to learn more about the United States. On this event, we'll be having real life heroes in healthcare. But before we begin, I would like to share with you a little fun fact. Did you know that the Pan American Health Organization is the oldest international health agency in the world? Well, if you have more fun fact related to healthcare, feel free to share with us on our social media. Well, without further ado, I would like to invite our moderator for this event. She is Awani Yamura, a former regional trainer for Google Ads Project Kuala Lumpur. Kak Awani, the stage is yours.
Thank you so much Hanin. Selamat datang, selamat bergabung di Ed Amerika. Selamat sore semuanya. Semoga pada sehat-sehat semua ya di sini. Sesuai dengan tema kita kali ini, kita mengangkat real life heroes in healthcare. We believe all of you, we are all heroes here, and the most important thing, we have two outstanding narasumber yang sudah luar biasa sekali pencapaiannya, achievements. There are a lot of achievements coming from them. So without any further ado, I would like to introduce our guest today. First, we have Mr. Farouk Mirali, which is the founder of Swipe RX. Am I pronounced it correctly? Okay, please welcome Mr. Farouk. Nice to meet you. This is the first time us meeting in physical. And we have Dr. Dafrina Rianda. Iya, ini kalau panggilan akrabnya boleh dipanggil siapa Mbak?
Dafrina.
Dafrina, baik. Ya. Baik, ini luar biasa sekali ya. Nanti akan ada penyampaian dan pemaparan materi oleh dua narasumber kita yang luar biasa. Teman-teman semuanya, baik yang ada di Ed Amerika maupun yang ada di rumah, bisa follow di sosial media kita. Sekiranya nanti ada pertanyaan atau ada yang ingin didiskusikan lebih lanjut dengan dua narasumber kita ini, bisa langsung saja kunjungi sosial media kita dan bisa langsung tuliskan pertanyaan teman-teman semuanya yang ada di sana. Baik, mungkin tak kenal maka kata sayang, betul ya, maka saya akan perkenalkan terlebih dahulu. Mr. Farouk Mirali merupakan founder of Swipe RX, formerly M Clinica, a healthcare startup connecting pharmacies in emerging markets through a common mobile technology platform across Southeast Asia. Wow, banyak sekali nih prestasinya teman-teman. Has held senior roles in strategy and product development at global pharmaceutical companies such as Pfizer, Sanofi, and Roche, am I correctly?
Roche.
Yeah. Roche, I'm sorry. Okay, he's also an awardee of the Harvard Alumni Public Health Innovator, and he's also Health Policy and Management, MS Harvard University, USA. Mr. Farouk, welcome at America. And kemudian kita juga punya Dr. Dafrina Rianda, seorang founder dan director of content development at Lab Pintar, Indonesia, a startup promoting evidence-based decision-making among parents for smart and healthy generations. Kemudian merupakan salah satu project coordinator of an assessment of the impact of COVID-19 on pregnancy care and outcomes, nutrition, morbidity, and mortality. Kemudian Dr. Davina juga merupakan seorang Indonesian representative for the Alumni Thematic International Exchange Seminars or TIES on Public Health and Climate Crisis in the Indo-Pacific, U.S. Department of State's Bureau of Educational and Cultural Affairs in 2022. Dan sebenarnya masih banyak lagi ya, tapi saya sebutin yang terakhir aja ya. Satu lagi Mbak, alumni of the 2021 YCLE program of the U.S. Asian Women's Leadership Academy. Selamat datang Dr. Dafrina. Baik, tanpa memperpanjang, kayaknya gak enak kalau saya doang yang ngomong di sini ya teman-teman. Mungkin kita langsung saja ke presentasi seperti yang sudah kita rencanakan sebelumnya. Akan ada presentasi dan sedikit short video dari masing-masing narasumber. Untuk yang pertama kita persilahkan terlebih dahulu kepada Dr. Farouk Mirali. To Doctor, time is yours.
Saya Indah Fajriati, umur saya 24 tahun. Saya bekerja di Apotik Saera sebagai asisten apoteker. Kegiatan sehari-hari saya di Apotik Saera menerima resep, pelayanan informasi obat, meracik obat, penjualan, dan stok obat. Sebelum menggunakan swab RX, kita order tuh sangat ribet, susah. Nunggu sales datang baru bisa order. Sekarang sesudah menggunakan swab RX, semua lebih gampang dan cepat. Kita buka HP, kita buka aplikasi, pesen deh. Pakai swab RX, obat di Saera menjadi lengkap semuanya. Terus juga banyak pasien yang butuh obat dan di swab RX adanya di situ. Makanya Apotik Saera order di swab RX aja. Kita tahu swab RX dari sales yang datang ke Apotik Saera. Kita memutuskan pakai swab RX karena kita lihat di aplikasi banyak diskon yang sangat menarik. Makanya kita menggunakan swab RX mulai dari 2018 sampai sekarang. Transaksi kita bertambah itu karena kita udah membandingkan harga obat di PBF lain dengan harga obat di swab RX. Dan kita lihat di swab RX itu lebih banyak diskonnya, lebih lengkap. Makanya kita beralih semuanya ke swab RX lagi. Untuk Apotik Saera, semoga Apotik Saera lebih maju, berkembang, dan obat-obat di Apotik Saera lebih lengkap. Buruan deh untuk apotik-apotik lain, download aplikasi swab RX sekarang juga, dan rasakan manfaatnya.
Swipe RX.
Great. So good afternoon, everyone. My name is Farouk Merali. It's a pleasure to be with you this afternoon. And the video you just saw is a good summary of some of the work that we do with pharmacies across Indonesia and across Southeast Asia. So today I'll take you through a very specific problem. It's the problem of pharmacies and how they help improve community health across the region. So, let me first take a step back. So as many of you know, there are apotheks across Indonesia. In fact, there are more than 30,000 small independent pharmacies or apotheks. And these are very important in the communities that they serve. In fact, on average, a patient or person will see a pharmacy 12 times a year in Indonesia, but a doctor only 1.2 times a year. So pharmacies are very, very critical points in the communities that they serve. And they have a real value in terms of providing healthcare, quality, availability, and affordability of medicine to end patients. So SwiperX is all about empowering pharmacies to help public health outcomes in Indonesia and across Southeast Asia. So what we do is we focus specifically on the pharmacy. We think these are very important players in the healthcare ecosystem. And our goal is essentially to empower them with the tools and information they need to better serve patients and manage their pharmacies. We actually operate across Southeast Asia. So first we started in the Philippines, and then we grew across Southeast Asia. And when we launched in Indonesia, it grew a lot. So I actually ended up moving here. I now have lived in Indonesia for almost 3 years and very much love it here, of course. So in terms of the problem that we're solving, when you look at these photos, you'll see pharmacies that are very typical of pharmacies that you see in your local communities, where they're small mom and pop shops, they're owned by small business owners, and you often go to them and you say, hey, how do I have this particular issue, can you help recommend something, do you have this product in stock? So they almost act like a pseudo doctor in a sense, right, where they're trying to provide medical advice and And the problem is, do they have the right information? Do they have the right education? And do they even have the products available that you need? How many times have you gone to a pharmacy and said, hey, do you have this in stock? And they're like, no, you don't. And then you go to 5 other pharmacies to try to find it. So the way we solve this problem is really through community-driven commerce. How do you build a community of pharmacy professionals, pharmacists, pharmacy assistants, owners and managers, and then also connect their pharmacies together? So think about it almost as a LinkedIn for pharmacy professionals meets an Amazon or Tokopedia for pharmacies. And so we have these two in the same app. So when we launched this, we first thought about community. It's something that I think Ad America does very well, which is how do you build the community around a particular area? And so what we did was we looked at all the things that pharmacy professionals needed and put them in one app. And so, for example, education. Before we arrived on the scene, pharmacists had to take a lot of their education offline. And they had to go to classrooms, they had to spend lots of time actually taking these lectures, sometimes had to pay for it. So we actually went and provided online free education that was accredited to the pharmacists so that they could actually take the courses and receive credits and renew their license. And just to share a small story, I remember one time I went to a pharmacist convention and this lady, she came up to me and she said, thank you. And I said, why are you thanking me? And she said, because before Swipe RX, I had to travel 6 hours in a bus, leave my 2 children at home, and sit in a classroom and take education. And with you, I did it at home for free, and I could spend time with my kids. And to me, that's a very real improvement in terms of how we are democratizing education access across the country and helping to improve the quality of care. Beyond that, we provide news and announcements, things that are relevant to the professional field in almost a news feed. I know a lot of you guys use Instagram and TikTok, so think about this, but more professional content. There's a collaboration where they can discuss different areas. For example, we have pharmacists all the time, every day, they ask questions like, I can't read this doctor's handwriting on this prescription, can someone else help me? So these are the types of questions that people will ask and get answers for. And so we have the largest crowdsourced database of information for pharmacists. Beyond that, they can do research on the platform. We have a drug directory, we have adverse events and B2B commerce as well. So as a result of that, we actually grew very quickly. We put about 1 in every 3 pharmacists across Southeast Asia uses our platform. And that, I think, is representative of how big the problem that we were solving was and how we actually went about solving it, which is really understanding the user, building a product that really responds to their needs, and helping them to actually solve their daily difficulties. So, as a result of that, we actually end up working with a lot of pharmaceutical companies. Many of them are from the US or from abroad, or many are actually local Indonesian companies, all of whom are trying to access the pharmacy channel. And by the same token, there are a lot of public health organizations, folks like the Bill and Melinda Gates Foundation, all the way to USAID, who we work with as well, who want to improve areas around tuberculosis or maternal child health or nutrition in the pharmacy. So ultimately, we had to connect this pharmacy channel digitally. And because we did that, we now provided an outlet for everyone from pharmaceutical companies to governments to NGOs to actually solve problems in public health. So sometimes you need a market-based mechanism to solve some of these very pressing healthcare challenges. So we had connected all this community together. In Indonesia alone, we have about half of all the pharmacists in the country who use our application. And then we wanted to launch commerce. So I'll give you a little bit of an understanding of this problem. So let's say you're a pharmacy owner. You'll wake up in the morning, you'll call different wholesalers and distributors, and you'll try to say, do you have stock of this product? And 1 week they have the stock, but the next week I call them, they don't have the stock. And if I can't get the stock, that means my customer, my patient, doesn't have the medicine that they need. Beyond that, there's affordability, right? Which is actually when pharmacies purchase their medicine, they can buy it at very different prices. Some will sell you the same product at 10% discount, the other one at 8% discount. Now, the problem is if the pharmacy pays more, that means the end consumer, the patient, pays more. So these are problems that happen upstream in the supply chain, but they affect the end patient. And from an accessibility perspective, pharmacies are spending hours doing their ordering and calling all these sellers instead of spending time with patients. So what we did was we built the largest network of pharmacies who are doing their purchasing through us. So chances are, if you go to your community apothec in your area, they're purchasing now through SwipeRx. And the reason why they do that is that, very simply, we provide them the stock that they need instantly, and we're able to deliver to them very, very quickly so that it's there when patients need them. Second, from an affordability perspective, and I think, we very much think academically around how do you make market-based mechanisms for addressing public health problems, right? And so what we figured out was that if you have a large enough pharmacy network and you have large enough volumes, you can negotiate better prices for them. And last year alone in Jakarta, we reduced the medicine prices by 10%. So if we reduce them by 10%, then that means the customers, the patients, paid less for their medicine, right? And that's how you start to solve public health challenges, and you do them in a sustainable manner. And from an accessibility perspective, all of that happens through an e-commerce-like experience. So pharmacists are not unlike you and I. We actually use, Shopee and Tokopedia and all these. This is their version for their medicine and inventory needs. So we've expanded quite a bit. We cover all of Indonesia, about more than 10,000 pharmacies across Indonesia are on this platform. And we also provide logistics, right? So we think that it's very important to be able to provide the right medicine at the right time in the right conditions to the pharmacies. And so we have this kind of national logistics system. And so our overall goal is, how do we build the largest purchasing network of pharmacies in Southeast Asia? And in doing so, how do we solve problems in affordability, access, and availability of medicine to tens of millions in the country? And really, I think, very much my background is in public health. And for me, the importance of SwipeRx is, how do you really think about improving the daily lives and healthcare for tens of millions? And I'm very happy to pass it to my co-panelist, who is also solving very pressing problems in public health. But thank you very much. And we'll go to Q&A later, I'm sure. Thank you.
Oke, thank you so much Mr. Farouk. Teman-teman buat yang punya pertanyaan, di-keep dulu ya. Saya pribadi sebenarnya I have a lot of questions towards you already, but we'll get through it later. Tapi selanjutnya kita dengarkan terlebih dahulu untuk panelis kita yang selanjutnya kepada Dr. Dafrina, disilakan.
Oke, halo, selamat sore semuanya. Perkenalkan, saya Dafrina Rianda. Saya adalah founder dari Lab Pintar. Background saya sebenarnya seorang dokter, a medical doctor, and also a researcher. But health education has always been my passion. Belakangan ini kita lihat banyak isu kesehatan yang muncul ya, mulai dari COVID and malnutrition, itu kayaknya nggak ada ujungnya juga gitu. Dan sebenarnya ketika kita melihat isu kesehatan ini secara global, drivernya itu sebenarnya adalah behaviors dari individualsnya, jadi perilaku dari individu gitu. Jadi ini adalah fenomena pertama yang aku lihat, dan kalau kita bicara tentang mengharapkan adanya perubahan perilaku, behavioral changes, the key has always been health education. Nah, aku pursue field health education ini sebenarnya sudah 12 tahun, for the past 12 years. Back in my college years, aku menjadi pemimpin umum di satu surat kabar namanya Media Skolapius yang diproduksi oleh mahasiswa kedokteran. Ini disebarkan ke puskesmas-puskesmas di hampir seluruh Indonesia. Saat lulus juga aku alhamdulillah mempublish 2 buku yang sebenarnya ini juga adalah part of health education effort. Yang satu buku ini fokusnya untuk women's health. Satu lagi ini adalah untuk maternal and child health, tapi kita package itu into like a more popular approach. Jadi ini adalah another effort on health education. Aku juga terlibat di banyak community outreach program dan juga seminar sebagai pembicara, penyuluh dan juga penyelenggara. Dan menjalani proses ini sebenarnya ada satu hal yang paling aku lihat, one thing I found is like a clear, visible gap antara scientific information coming from the scientists dan society. Gitu. Jadi gapnya itu ada banget. Apalagi sebagai seorang peneliti, sekarang aku banyak fokusnya di peneliti, itu kita kan peneliti baca hampir ribuan paper ya, aku mungkin bisa bilang ya, tons of paper. And then we also have unlimited access to academic paper. Jadi kita tuh bisa banget mengakses resource itu gitu. Dan untuk membacanya juga bagi seorang peneliti itu tuh mudah gitu. Tapi on the other hand, sebenarnya temuan-temuan penelitian, research findings ini sebenarnya helpful untuk all of us, not only the scientists gitu. Jadi ini yang fenomena ini yang aku lihat, aku mau kasih contoh paling gampang itu adalah misalnya karena aku banyak bergerak di bidang kesehatan dan gizi ibu dan anak, misalnya penggunaan suplemen omega 3 untuk ibu-ibu yang punya resiko berat badan bayi lahir rendah. Jadi itu research finding saya sudah ada, tapi pas aku turun ke lapangan itu tuh belum nyampe gitu ke komunitas gitu. Jadi gapnya itu visible banget. Nah makanya I always believe that democratized science is a must dan scientific knowledge itu harus di-repackage untuk reaching these communities to all of us sebenarnya gitu. Dan at the end ini akan membangun satu ekosistem yang berbasis pengetahuan, knowledge based ecosystem, sehingga semua dari kita nggak cuma di kesehatan ya, di hampir seluruh aspek itu bisa mengambil keputusan yang berbasis bukti sehingga lebih efektif. Termasuk tadi misalnya contoh sederhana penggunaan suplemen omega 3, penggunaan suplemen lainnya gitu. Jadi itu berdasarkan hasil penelitian yang nggak hanya bisa diakses oleh peneliti, tapi juga untuk kita semua. Nah dari ide inilah makanya kita membangun Lab Pintar. Ini adalah satu platform untuk mempromosikan keputusan berbasis bukti atau evidence based decision making pada keluarga di Indonesia, dan memang kita fokusnya adalah untuk kesehatan keluarga, gizi, dan kesehatan ibu dan anak, dan juga women's health. Nah ada 3 aktivitas utama kita, yaitu yang pertama adalah menyediakan informasi scientific yang sudah di-repackage sedemikian rupa sehingga itu tuh palatable, jadi gampang untuk ditangkap dan dipahami dan menarik untuk awam. Dan yang kedua adalah aktivitasnya untuk melakukan data collection. Kita melakukan identifikasi sebenarnya para calon orang tua dan orang tua mana sih yang sangat membutuhkan informasi ini ya, terutama palatable scientific information. Dan terakhir yang lagi banyak kita explore adalah education intervention on family health. Jadi kita sekarang juga sudah mulai mengcombine antara online platform sama offline activities. Untuk yang pertama, aktivitas penyediaan palatable scientific information, memang kita banyak menggunakan digital platform. Kenapa? Terutama sosial media, kenapa? Karena Indonesia tuh di tahun 2021 aja sudah punya 170 juta, 170 million of social media users in Indonesia, which is really huge numbers. And then itu diperkirakan akan mencapai lebih dari 200 juta di tahun 2026. Jadi social media itu sebenarnya platform yang masih oke dan masih terdepan untuk edukasi ini. Dan mungkin aku kasih contoh ya, kadang-kadang kita mikir ngaruh nggak sih kita edukasi di sosial media. Aku kasih contoh, di sini ada positive feedback dari salah satu dokter di puskesmas di Indonesia gitu yang merekomendasikan Lab Pintar sebagai learning resources bagi para calon pengantin gitu. Jadi sebenarnya ini juga at the end ini membantu dokter, tenaga kesehatan untuk memberikan edukasi gitu. Jadi punya ada referralnya dan ini selalu based on research ya. Jadi kita selalu nampilin referensinya gitu. Jadi ini yang pertama dan ongoing. Yang kedua adalah data collection ini kita mengidentifikasi dan ternyata memang yang paling penting dari data ini adalah ternyata para calon orang tua dan orang tua yang usianya lebih muda dan yang mengalami kesulitan untuk menemukan easy to read learning resources on childcare itu adalah the ones who more likely to less likely to have better knowledge on childcare and parenting. Jadi ternyata memang again ini penting gak cuma menyediakan pesannya aja tapi gimana mendeliver itu supaya itu menarik untuk dan mudah dipahami oleh awam. Dan yang terakhir adalah education intervention. Jadi memang Lab Pintar ini lahir di tengah pandemi. Sekarang kita mulai membuka combining antara offline dengan online karena memang kita akhirnya melihat ada part of community yang nggak bisa di reach dengan adanya online aja, social media aja. Karena ada yang memang nggak into social media gitu dan itu ada benar-benar ada di lapangan. Jadi kita coba combine, kita lagi testing uji prototype yang salah satunya sudah pernah memenangkan Wirausaha Muda Mandiri dan yang terbaru sebenarnya adalah namanya Mama for Planet. Jadi kita mensupport program Mama for Planet ini adalah program pemberdayaan ibu untuk mengurangi sampah rumah tangga. Terutama kita cadres empowerment ya, jadi mengempower kader yang ada di komunitas. Dan ini sebenarnya this is actually funded by the US Department of State gitu. Jadi we are really excited to implement this project this month. Dan semoga memang effort-effort edukasi ini bisa bermanfaat dan yang paling penting adalah mungkin aku sedikit pesan aja untuk teman-teman yang juga berjuang di health education. Yang paling aku sadari adalah ini butuh usaha, upaya kolektif gitu. Apalagi kalau kita berharap behavioral changes, itu akan took a long time dan kita nggak pernah tahu sebenarnya kapan message mana yang nyampe gitu. Jadi kita sangat open untuk kolaborasi, feel free to contact us also here. Ya, @labpintar di Instagram dan juga ada email, Twitter, and Facebook. I think that's the end of my presentation and back to Mbak Awani. Thank you.
Thank you so much. Well, it was a really informative presentations dan sesuai dengan temanya memang beliau narasumber kita ini memang sudah menjadi real life hero sekali di society kita, where they can provide a good health care and towards our society. Dan teman-teman semuanya, Mr. Farouk and Dr. Dafrina, kita sudah banyak sekali pertanyaan sebenarnya ya yang sudah muncul di sosial media. Well, I think we should go to straightforward for the Q&A session. If it's possible, I would like, there is a very eye-catching questions coming up from our the netizens from the audience. Username is Ibnu. Where actually it's also part of my questions I would like to ask for both of you. What is exactly the innovation, the things that motivates both of you to create things like this? Karena pada dasarnya pasti perubahan itu tidak semuanya itu datang dari dalam diri kita. Mungkin ada yang datang dari luar. Nah, tapi kadang-kadang we tend to wait someone else to do something to the society, right? And sometimes we think it's not our job, it's not our responsibility, it should be the government. So I would like to know what innovates you to actually start this kind of organizations or program. Maybe we can start from Mr. Farouk.
Sure, thanks for the question. So maybe I'll tell you why I started this in the first place. So, you know, my general philosophy on life has always been around, you know, collecting stories for the grandchildren. When you're very old and you have small little grandchildren, what stories will you tell them? Will you tell them stories that are very simple, like I went to work at 8 o'clock, I left at 5 o'clock, I made a company, lots of money? Or do you say, you know, I tried to spend my life solving very big problems. I took an adventure that took me across continents, and I did very interesting things that tried to improve society, right? And those are more interesting stories to me to tell. And so that's been a governing theme of my life. And I think, you know, the choice to do this particular problem, I was living in San Francisco. I had actually a very great job, easy job. You know, I was working at a big pharmaceutical company. I had like a very nice executive role, but I didn't feel a lot of meaning. I thought that, you know, this company had 80,000 people. If I leave tomorrow, everything will be fine, right? But I kept seeing this problem of pharmacies and nobody was solving it. And so I said, you know, if I could figure out how to solve that and bring a team together to do it, then that's worth it, right? That's something truly transformational, not just incremental, right? And I think it's very easy in life to be very comfortable. Comfort is easy, but sometimes, you know, you need to do things that are uncomfortable to do something different. So I actually had this idea and I pitched it to a big pharma company and I said, look, I want to start Swipe RX. He said, look, I'll be your first client, do it in the Philippines. So I'd never even been to the Philippines before. But, you know, when life gives you an opportunity, sometimes you take it. So I left San Francisco. I quit my very nice, you know, job. I put all my savings into this business. I got on a plane to the Philippines. It's a country I'd never been to, with no team, with no technology. And I had 60 days to get the first pharmacy in. Otherwise, I lost the first payment. So luckily, I found a great team. You know, we built the prototype, we got the first pharmacy in, and then we started growing. So I think, you know, to go back to the question, it is really around what is your personal philosophy? What do you get fulfillment around professionally? And what do you want to leave as your end legacy, right? And I think if you can answer those three questions, that will compel you to do things that are sometimes very difficult, sometimes very uncomfortable, but sometimes very rewarding in the end, right?
Yeah, I think Farouk has answered that question really well. I just add, I think it's also important to, you know, finding your own callings. Jadi aku dari perjalanan itu, makanya kenapa aku masukin perjalanan itu karena ini tuh nggak yang tiba-tiba instan kayak ayah mau deh ngelakuin ini gitu. Jadi setelah melakukan itu aku ketemu banyak berbagai macam komunitas. Maksudnya nggak cuman yang student aja gitu, tapi juga ibu-ibu segala macam. Dan itu apa ya? Aku ngerasa kayak heartbroken aja ya, ngelihat patah hati banget, ngelihat informasinya tuh ada, tapi ini tuh kok nggak nyampe gitu ya. Dan itu tuh kadang-kadang itu sebenarnya kalau informasinya sampai, itu bisa bikin major changes loh di kehidupan seseorang. Apalagi kalau kita ngomongin anak, the first 1000 days of life. Kayak misalnya tadi mencegah untuk low birth weight baby, itu kan informasi yang sebenarnya simple tapi saya nggak nyampe gitu. Jadi makanya sampai sekarang tuh setiap ngelihat ada satu informasi yang ini tuh useful banget, tapi kenapa masih ada di lapangan yang itu selalu selalu bikin membakar lagi sih semangat itu. Memang gak mudah, apalagi tadi Swipe RX itu is a really huge platform dan pastikan membangunnya itu butuh waktu gitu. Tapi memang penting untuk menemukan your own callings, your own philosophy gitu untuk membakar semangat kita lagi ngejar ini terus gitu. Dan again ini tuh gak yang one shot, jadi failure itu pasti akan ditemui gitu. Tapi percayalah kalau kita udah ngikutin callings kita, at the end itu akan worth it sih gitu.
Well, thank you. Please give a big applause for our two panelists. Still we have questions towards that, which is still related to the first questions. Banyak dari teman-teman kita di sini yang menganggap bahwa it's really hard to start something, like considering about the savings, and also the sponsorship. It's not gonna be easy for you to get those. Jadi ada yang bertanya juga kepada kedua panelis sebenarnya, dari Mbak Niswa dari Facebook dan juga dari dari Mas Bayu di Instagram yang mungkin hampir mirip pertanyaannya, yang bertanya bahwa what is actually the challenges that you encountered during building this program. And personally they also ask about they wanted to start something, but they do know it's not easy and they have nothing to actually start this kind of organizations or platform. So what is your suggestions to these maybe young generations that maybe would like to follow your pattern? So maybe we can from Miss Davina first.
Oke. Ini pertanyaan bagus-bagus banget ya. Jadi aku sih bisa itu rasanya relatable banget sih, dan kayaknya banyak juga yang merasakan hal yang sama. Tapi mungkin ada satu yang paling penting adalah lakuin aja dulu gitu. Just do it, just do it, and then later you can evaluate that. Jadi coba dulu aja. Nanti juga kita bisa jadi kayak coba evaluasi sampai nanti akan nemu bentuk terbaiknya gitu. Jadi nggak perlu mungkin dengan step yang besar-besar dulu gitu, tapi yang dari yang step kecil aja, uji coba prototipe kecil-kecil itu juga matter sebenarnya gitu. Jadi itu yang pertama. Dan yang kedua adalah untuk menemukan ini sih yang menurut aku agak susah adalah challenges-nya itu adalah menemukan the core team yang kita bisa rely on dan punya the same vision gitu. Jadi akan ngelakuin ini terus dengan effort yang maksimal sampai visi ini tercapai. Dan membangun platform ini kan I have to say ini gak cuma about the money ya. Maksudnya ini kan pasti callings, ini kan pasti kita punya ini kan humanity kan gitu. Jadi finding someone yang punya humanity itu dengan visi yang sama kayak kita, itu kalau kita berhasil nemu itu gold banget gitu.
What about Mr. Farooq?
Yeah, so I think this comes down to a big lesson in life, which is actually it's all about balancing risk and reward, right? And the question with a startup is most startups will not succeed, and that's the sad truth of it all. And I see people try it all the time, and I'm so happy they try it, as you said. But sometimes there are ways to actually reduce your risk before you take it. For example, many people say, "Oh, I need to quit my job to work on a startup." Is that really true? I mean, there's enough hours in the day, sleep less, maybe try it out, do something on the side. And as you said, build these small prototypes, right? Small MVPs, which are called minimal viable products, which test, do customers actually like what you are creating? Do people actually want to pay for something? Do you actually create value in the service? And there are very much easy ways to do that. For example, sometimes you don't even need to build all the technology. You can run a startup on Google Sheets or any of these new technologies that occur, and that will give you a great level of insight on, do you have some interest in your product? And you can do that in a very low risk way. Keep your job, do this on the side, do it on weekends, do it on nights. Once you see more and more proof, it allows you to say, hey, my risk is a little bit lower, my probability of reward is higher, maybe I should take that next step. And I will tell you one thing that Indonesia has that's amazing right now, which is it is easier than ever to start a startup because there's more capital than ever. There's more support for startups than ever before. The government is very, very supportive of technology, which helps a lot. And private capital has moved into the market as well. So if you are a young person with a great idea and you have some level of proof that it is working, it is now easier than ever to get external capital, right? And I'm happy to point you in directions of resources to do that. But really, if I were a young person today in Indonesia, wow, I would be very excited about the future. So, yeah.
Thank you so much. Jadi kalau misalnya saya boleh bikin kesimpulan, berarti ya mulai dulu aja gitu ya, Mbak Davrina and Mr. Farooq. Maybe start from yourself, and then start from the small community, and then maybe you can get bigger from that society. Alright, ini juga ada pertanyaan lebih lanjut dari teman kita, dari Mbak Dana, ya mohon maaf apakah Mbak atau Mas Dana, itu dari Zoom juga. Ada yang bertanya bahwa menurut Dana, peran pemerintah ini sangat amat penting untuk mengatasi masalah kesehatan dan juga masalah permasalahan yang ada di Indonesia terutama. Nah, menurut Dr. Davina dan juga Mr. Farooq, sebenarnya pemeran pemerintah itu sepenting apa, dan selama Mr. Farooq dan juga Mbak Davina itu menjalankan program ini, apakah sudah bekerja sama langsung dengan government atau belum? Maybe I would like to translate to Mr. Farooq first. So Dana thinks that actually government's responsibility is very important in this current situation related to the healthcare, and he's asking whether you have collaborating together with the government, and do you think how important it is for a government to actually taking care of the healthcare situation in Indonesia? Maybe from Mr. Farooq.
Sure. So the government has a very critical role to play, right? And I think there are two sides to healthcare delivery. One is the public system. So that is when you as a citizen, let's say, are covered under BPJS, you see a puskesmas, you get treatment there, and it's all covered under the government. And then there's the private sector, right, which is private hospitals, private pharmacies, where you will pay usually out of pocket or have private insurance to cover you. And I think generally the government's job is a regulator, right, which is make sure that the quality of care is high, make sure that when services are delivered, they fill a standard that treats the citizens well. When medicines are actually transported and stored, that are of high quality, and that is the job of government as a regulator. On the public sector side, they play an even bigger role, right? Because they're also paying for healthcare, they're financing it, they're providing the services, they're paying for all the services around that delivery. And so they're very, very important. So I think, healthcare generally, the government has a very key role, both as a regulator to improve the quality of services to its citizens, but also as a financial provider and also as an investor in healthcare services, building hospitals, building hard infrastructure for its citizens. What we do is we work a lot with the public sector. We work with Chem and Kes directly on various different projects, all the way from COVID-19 to nutrition to tuberculosis. So we have very close relationships with them. We also work with bilateral organizations like USAID, with the Australian government, so on. And increasingly so, we're doing a lot of work with BOMN organizations like Biopharma, Kimia Pharma, FAPROS, Telcom. So we work a lot with that. We think they're very integral to healthcare, given the size, scale, and resources that they have to mobilize towards improving public health.
Oke. Kalau ya bicara tentang, mungkin aku juga spesifik gizi dan kesehatan ya di Indonesia itu, aku nambahin juga jawaban dari Farouk adalah memang di sini tuh kompleks. Jadi kalau in terms of the role dari government itu pasti harus ada gitu, pasti harus ada. Tapi sekarang mungkin eranya nggak hanya top down approach, tapi juga bottom up. Jadi sebenarnya aktivitas-aktivitas level grassroots yang mungkin diinisiasi oleh orang yang di luar pemerintah itu mungkin pada beberapa titik itu lebih efektif gitu, karena mungkin yang lebih sering bertemu dengan komunitasnya misalnya, dan tidak menutup kemungkinan aktivitas-aktivitas seperti ini nantinya bisa dibawa ke pemerintah yang tadi mungkin seperti yang Far sudah jelaskan gitu, jadi dan akan disupport pemerintah. Di Lab Pintar sendiri sebenarnya yang di aktivitas yang sekarang kita lagi mau jalan itu Mama for Planet. Kita support Mama for Planet sekalian juga untuk testing prototype di sana, yang sebenarnya nanti akan dijelaskan lebih lanjut di sesi yang Real Life Heroes in Environment kalau nggak salah oleh Mas Fauzan. Itu kita bekerja sama dengan pemerintah Kabupaten Sleman gitu, dan aku harus bilang bahwa sebenarnya pemerintah itu sangat terbuka, tapi mungkin kalau untuk teman-teman yang ingin menjalin kerjasama dan kolaborasi juga harus memahami sebenarnya fokus isunya, karena kan isu ini kan banyak sekali ya gitu, jadi melihat lagi-lagi lihat ke datanya gitu ya, dan kalau memang itu menjadi fokus isu pemerintah setempat, itu pasti kok akan disupport dengan either itu funding resources atau juga support untuk ya pasti advice ya gitu. Jadi sangat terbuka gitu selama itu memang align dengan issues, dan lagi-lagi itu harus kembali ke data yang ada gitu.
Well, thank you so much, Mr. Farouk and Ms. Dafrina. Still give a big applause, guys, to our two panelists. Actually, I have a personal questions to both of you. I noticed that the major or the significant things that being used in this platform is actually the digital based, where you use the applications, you use the book, and also the social media. Where I think, especially in Indonesia, where I came from, a very small village in Padang, West Sumatra, I believe here in Indonesia we have like a stereotype where we transform something from conventional to modern technology. It's not easy to actually approach our society to believe and convince them, okay, this is a very good movement, please try it, something like that. So I would like to know what is your approach towards the society to convince them, untuk meyakinkan mereka bahwa try this is actually gonna ease your problem, maybe solve your problem. So what is actually your approach to make sure that this transformation is not, creating more problems in the society? Maybe from Mr. Farouk?
Sure. So I think you mentioned it. It's start with the problem first, right? So the solution is actually quite secondary. You have to start with what is the problem that you're solving. So in our case, it's pharmacies spend too much time, they spend too much money, and they still don't get what they're trying to get solved, right? So can you come into them and say, hey, I can help you solve X, Y, and Z, and this is the way I will do it, right? So it's a problem-oriented sort of solution. The technology is second. I think the benefit of being in Indonesia in this day and age is the mobile penetration is very, very high, and the population is very young. So these two things help to create very high adoption for technology. So even if, let's say, the store owner is very old, there'll be some younger person working in the store and it can help to assist in that sort of training. So I think being problem-oriented first, and then helping to ease the adoption of technology by just its general readiness, right? So I think very hard to do an apples to apples comparison. Yeah.
Yeah, I think it's pretty much clear, but maybe we would like to hear from Miss Davina, as actually you've been living in Indonesia quite longer, but you also have been in United States before, right? Maybe you can share it with us.
Iya, iya ini ya sebenarnya sih ini mungkin aku mau coba kasih perspektif karena di program Mama for Planet yang juga di-support Lab Pintar itu kita ada tim dari US, ada tim dari Indonesia. Jadi kita kolaborasi di sana gitu. Jadi kita saling ada proses tukar pikiran lah di sana gitu. Dan betul sih kata Faruk bahwa di beberapa aspek kita bisa mencontoh, di beberapa aspek sebenarnya Indonesia udah oke. Yang mungkin salah satu contoh yang Indonesia cukup oke adalah begitu banyaknya community empowerment sih di sini gitu. Terutama sistem misalnya ada kader itu nggak ada di US gitu, sistem itu gitu. Jadi pemberdayaan masyarakat di Indonesia itu sebenarnya itu bagus gitu. Jadi sekarang tinggal kita wadahi aja supaya lebih berkualitas gitu. Dan dari teman-teman yang di US kita banyak belajar memang tentang teknologi gitu, karena mereka dari segi teknologi sudah lebih banyak mengeksplor hal itu ya, mungkin melalui riset dan segala macamnya gitu. Jadi menurut aku memang setuju dengan Faruk, ada yang plus di sini, ada yang plus di sini gitu. Jadi sebenarnya itu at the end in terms of like project implementation sebenarnya itu kalau di-combine itu malah jadinya useful gitu, saling melengkapi gitu.
Maaf Mbak, saya mau tanya spesifik, ini yang kader itu tadi program dari pemerintah kah atau dari Lab Pintar?
Kader itu jadi di Mama for Planet, Lab Pintar sebagai part dari Mama for Planet juga, kita bikin modul edukasi untuk kader. Kadres is actually like a mother's champion in the community. So have you ever heard about
Yes,
kader?
yeah.
Kader ya. So jadi kader itu kan sebenarnya sudah ada di komunitas ya. Mungkin aku juga bisa bilang itu juga part of the government juga gitu. Dan pas kita cerita gitu dengan tim yang dari US juga, oh kita nggak ada tuh sebenarnya hal kayak gitu. Jadi sebenarnya banyak sebenarnya potensi yang ada di Indonesia, dan Faruk juga sudah banyak banget menyebutkan banyak a lot of potentials ya that we can empower Indonesia gitu. Jadi mungkin itu sih that I would like to add ya.
Wow, ini juga informasi baru ya sebenarnya buat saya, bahwa ternyata kader untuk healthcare di society itu ada ternyata. I think it's also new information, not only for me but also for audiences in back here and also at home. So aku ada pertanyaan spesifik nih sebenarnya untuk Dr. Davina. Tadi Dr. Davina bilang bahwa untuk saat sekarang ini memang approach yang paling maksudnya paling make sense dan paling relevan itu adalah menggunakan sosial media karena memang penggunanya banyak begitu ya. Mungkin ini aku mau sharing sedikit juga karena ini meresahkan juga. I'm actually a very active social media user. So most of the time my friends and I use social media to find the informations, but we found like a lot of like back and forth informations coming. One doctor claimed that he or she is very good doctor, but with totally different informations. And then this one doctor claimed this is the right information. So as Lab Pintar, karena memang menggunakan sosial media itu sendiri, sebenarnya intervensi atau mungkin apa sih sebenarnya pendekatan yang atau usaha yang dilakukan oleh Lab Pintar kemudian untuk memastikan bahwa informasi yang disampaikan itu kalau bisa jangan sampai berbeda antara satu saintis dengan saintis yang lainnya begitu.
Iya, bagus sekali pertanyaannya Mbak Awani. Jadi betul, sebenarnya kita punya ada hierarki dari bukti ilmiah ya, dan sebenarnya expert opinion masuk, tapi memang itu yang at the very bottom. Sebenarnya kita punya, harusnya di atasnya ada riset-riset, dan terakhir ada meta analysis. Dan sebenarnya di Lab Pintar itu walaupun penggunanya adalah awam, itu yang kita paling ajarkan paling awal gitu. Jadi kita informasikan bahwa sebenarnya memang kalau kita bicara tentang bukti ilmiah, pasti referensi utamanya itu harus yang penelitian, dan penelitian itu ada tingkat-tingkatannya, dan itu yang kita jelaskan di awal gitu. Nah, oleh karena itu pendekatan yang Lab Pintar lakukan adalah kita refernya itu bukan opinion, walaupun yang menganalisis itu dari expert gitu ya, tapi harus refer pada findings research gitu. Dan yang paling penting adalah kita juga mengadres keterbatasan dari penelitian, karena ini yang sebenarnya nggak kadang kurang disampaikan gitu. Jadi misalnya kita bisa bilang iya ini efektif kok gitu, tapi sebenarnya ada loh keterbatasannya, dan itu yang sebenarnya harus diadres, the limitation of the research itself, Itu yang kita address di Lab Pintar gitu, dan itu sebenarnya approach yang jarang sebenarnya digunakan gitu. Dan ya sebenarnya kita juga nggak bisa menyalahkan misalnya, oh iya nih kenapa dokter ini bilang ini beda gitu, karena mungkin perjalanan praktik kliniknya berbeda gitu ya, tapi at the end sebenarnya kita harus refer pada bukti ilmiah yang tingkatan-tingkatan di atasnya gitu. Jadi that's also the way we try to address that ya.
I see. Jadi try to be netral ya Mbak ya, maksudnya
Betul.
tanpa menyudutkan pihak-pihak tertentu, apalagi sekarang banyak tuh ibu-ibu yang lebih refer ke perkataan orang tua, bagaimana cara mengasuh pola asuh anak yang lebih baik, bahkan kayak misalnya memberi makan di usia berapa itu mungkin lebih lihat ke, oh gini dulu mama kayak gini nih gitu.
Ya,
misalnya
dan mungkin
kan.
ngelihat ibu-ibu lain juga di sosial
Betul.
media seperti itu gitu
Nah,
kan.
nah jadi mungkin Lab Pintar lebih ya udah kita ke yang sifatnya scientifically proven. Berarti kita melihat ke artikel-artikel atau jurnal-jurnal ilmiah yang memang tingkatannya itu lebih tinggi dan bisa dipertanggungjawabkan lah ya Mbak ya ibaratnya, betul. Baik. Terima kasih sekali Mbak Davrina. So masih ada pertanyaan lagi, ini lebih ke keduanya, both of you. So related to this platform, both Swipe RX and also Lab Pintar, actually we've talked about this, like you must be, facing a lot of challenges when you are building this platform. Tadi kalau dari Mbak Davrina bilang untuk menemukan tim yang, partner yang cocok untuk menjalankan ini, the same visions, the same integrity, work ethic is going to be really hard. But we haven't heard from Mr. Farouk maybe what are the challenges that you found earlier when you start this platform?
Yeah, so I mean, I think the challenges never end, right? It's just the size of the challenges change, right? And I think whether you're starting out or you're in a growth stage, there are just different types of challenges. I think team is very important, right? Because you have the ability, if you have a great team, to ride through the challenges. And I think when you're starting a company, it's very important you know who you're working with, right? And everyone, you think that the partner is going to work out the way you want it to work out, but sometimes it doesn't, right? And luckily I've never had to go through that, but I've seen many other startups who have multiple co-founders who go through this challenge, right? So be very careful on who you work with, test them, they should test you, and you should understand that it's a very long journey together. So it's not just, I'll do this for a year and it's fine. It might be 3, 4, 5 years. So really be careful about who you pick, because that's the team that you're going to go and encounter the challenges with.
All right, thank you so much Mr. Farouk. Well, kita sebenarnya masih banyak sekali pertanyaan online, tapi tidak lengkap rasanya kalau kita juga tidak mengapresiasi teman-teman kita yang sudah hadir offline di sini ya teman-temannya, Mr. Farouk and Miss Davrina. We have multiple audiences here. We're far away from outside Jakarta. Perhaps they would like to meet you in person and also ask questions. Jadi mungkin ada audiens di sini mungkin yang ingin bertanya kepada salah satu dari panelis kita. Mungkin bisa berdiri, silakan ya. Perkenalan dulu, kemudian disebutkan ingin bertanya kepada siapa dan pertanyaannya.
Okay, thank you. Hi, Miss Davrina and Mr. Farouk. Good afternoon. I'm Reza and this is my friend Mutiara. We are pharmacy student from Universitas Pajajaran, and we're really excited about this topic because it's related about healthcare and pharmaceutical. We have 2 questions for Mr. Farouk because this topic is so related. First question, I want to ask about pharmaceutical supply chain. About purchase of medicines and medical devices can be done on the Swipe RX application, right? Based on your presentation, you said Swipe RX are already collaborate with the pharmaceutical industry like GSK and Sanofi. Is the purchase directly through the industry or the distribution first? Because based on regulation, an industry cannot directly distribute to pharmacies, but they have sent it to pharmaceutical wholesalers or PBF or distributor first. Or does this application work by replacing by the role of pharmaceutical wholesalers or pharmaceutical distributors? And the second question for my friend Mutiara, for the purchase of the drugs, we have to get an invoice, right? Do we get an online invoice in this application? And can this application guarantee that the invoice is not misused? Thank you.
Thank
Wow,
you
okay.
teman-teman. Berikan
question.
applause ya. I think it's very practical and also a good question. Maybe
Yeah,
you can answer
very
that.
specific questions. I know you guys are pharmacists, so first of all, amazing. I'm glad you guys are part of this audience. So I think so. First of all, on the regulation, right? So we actually have a PBF license, so it allows us to actually trade in a very clear way. So we work with BPOM, we work with Chem and Kes to basically allow us to do that. And you're absolutely right. You need that type of license. We negotiate with the principals or the pharma companies. We make sure that when we sell to the pharmacy that we have all the invoice and all the procedures per the BPOM protocol. So we make sure that we're aligned to that, right? So pharmacies know that they have the invoice, they have the batch lot, the expiry date, all the requisite information there. I mean, we work with more than 6,000 plus pharmacies. So yeah, so we do that quite a lot. Yeah. Sorry, what was the second question there?
For the purchase of the drugs, we
Yeah.
have to get an invoice. And can this
right.
application guarantee that the invoice is not misused?
Yeah, so the invoice is to the pharmacy, right?
Participate. So it's called If I Become a President. So here we have our real life heroes who already make something, creating a platform like Lab Pintar and also Swap RX. But apart from that, we believe young generations, teman-teman semua di sini pasti punya mimpi, punya keinginan, and I would like to know, we actually would like to know, mungkin ada yang ingin berpartisipasi nih, pertanyaannya adalah jika teman-teman jadi presiden misalnya, apa yang akan teman-teman lakukan? Ada yang tertarik mungkin untuk menyampaikan pendapatnya? Mungkin dari teman-teman yang tadi sebelumnya dari dari farmasi bisa sharing. Ya, ini sekadar brainstorming aja ya teman-teman yang nggak perlu cemas. Mr. Farouk or Miss Dafrina nggak akan judge juga kok. Maybe we would know. There will be no judgment. So if you become a president, what will you do? Boleh silakan Mbak, berikan tepuk tangan dong teman-teman ya.
Okay, thank you. I want to introduce myself first. My name is Raiza. I am pharmacy student from Universitas Pajajaran. If I became a president or a Ministry of Healthcare, I want to innovate more about healthcare, and I want to appreciate in this era, Ministry of Healthcare is developed about biological, and it's really great to step one more step to to more one step more to be great for this country. And I want to make all the nation have the same healthcare, and in the villagers or in town has the same growth about healthcare. Yeah, thank you.
Thank you so much. Berikan applause dong teman-teman. Itu menurut gimana nih Mbak Davrina? Itu mulia kan ya sebenarnya? Gimana? Ada
Iya,
komentar nggak nih Kak?
Accessibility ya, jadi quality accessibility itu penting sekali ya, dan kita banyak juga angkat di sini bahwa gapnya itu juga kesenjangannya itu ada, jadi itu it's a really great vision.
Yes. Dan semoga ya Mbak ya nanti bisa tercapai keinginannya, mungkin gak jadi presiden gak apa-apa, tadi bilang mau jadi menteri kesehatan ya, semoga. We hope you maybe in the future I will see your name in the cabinet system to become the Ministry of Health. Ada lagi mungkin calon-calon presiden atau calon-calon menteri yang lain? Silahkan masnya. Berikan tepuk tangan juga dong.
Applause. Thank you. My name is Brian, and I come from a psychology background. I think it's still related for the healthcare system. So if I become a president, I would like to establish a platform where young generation can seek help within the about their mental health condition, so they can have a better.
We don't have much in terms of the medicine for mental illness. It's mostly controlled substances, so we don't do that. But we do a lot of education of pharmacy professionals on how to assess mental health. One of our thesis is that pharmacists play a very big role in counseling communities. They're very important in public health, but they're not well equipped necessarily with the skills to assess mental health and to help improve it, or to refer to clinics for further follow-up. So a lot of our work goes around helping basic understanding around mental health, how to assess it, how to help customers and patients to find the right resources and help with doctors and so on. So that's where we come in.
Right, thank you so much. Berikan tepuk tangan sekali lagi dan terima kasih juga nih untuk calon-calon presiden atau calon-calon menteri tadi yang sudah mau men-sharekan pemikirannya. But guys, you don't have to be president, you don't have to be Ministry of Healthcare. You can be real life heroes just the way you are right now by making a small movement, just like what Miss Davina and also Mr. Farouk did just now. Oke. Baik, kita masih ada satu pertanyaan terakhir dari online yang belum terjawab, yaitu what is your next goal towards this platform? Maybe from Mr. Farouk.
Yeah, sure. So I think we're far from done, right? Until we feel that medicines are available, they're affordable, and the quality of care is great or exceptional, we won't stop, right? And I think there's so many challenges in public health. So we don't sleep very much. We work a lot. Because the problem is very large, but it is very meaningful, and that's why we work on it.
All right, Miss Davina.
Next goal would be mungkin education intervention yang punya accessibility untuk orang-orang yang nggak into online platform. Jadi kita udah mulai inisiasi di Mangful Planet, tapi again ini masih path yang jauh sekali gitu. Tapi isu kesenjangan itu ada dan itu real gitu. Dan sayang sekali kalau komunitas-komunitas itu tidak terjangkau gitu. Jadi next goal would be that one, and also how to also scale up the program itself. Yeah.
Alright, thank you so much. Oke, mungkin kita sudah sampai di sini dulu nih sesi Q&A-nya. I think the Q&A is over. We believe there are more questions coming out in the online platform, but unfortunately due to the time limitation, we cannot talk about it right now. So before we close, or before I hand over this program, I would like to ask both panelists to make a closing statement to actually empowering our young generations to, just be real life heroes like you. From Miss Davina.
Closing statement, apapun mimpi yang kita punya, apapun niatan yang kita punya, percaya dan lakuin aja. Karena bagaimana kita bisa bikin orang lain percaya sama kita kalau kita sendiri nggak percaya dengan mimpi yang kita